Hello everyone, my name is Samuel Ashkar and I will be presenting my culminating activity part 1. Here are the list of topics in this presentation that I'll be discussing. Number 1, description of the kidneys, description of kidney stones, types of kidney stones, symptoms for kidney stones, how do they form, causes for kidney stones, invasive and non-invasive treatments, options for patients, and the pros and cons for invasive and non-invasive treatments for treatment options, and the link between kidney stones and the solubility product concept, the relation between this topic and the concepts learned in this course, and many more. So let's get right into it. The question that I will be discussing originates from the Unit 3 topic, Chemical Systems and Equilibrium. The question is, how do kidney stones form, and how does this topic link to the solubility product concept? And the second question that I'll be dealing with is, what are some invasive and non-invasive treatment options available to patients? What, but first, before we can do anything about this, we have to understand what exactly are kidneys. Kidneys are a pair of organs located in the abdomen. Their primary function is to remove waste and excess blood water from the body as urine and to help balance chemicals in the body, such as sodium and potassium. Additionally, they produce hormones that control blood pressure and stimulate the production of red blood cells in the bone marrow. And as you can see on the screen, those are the two kidneys that everyone has. And so basically, what they are is kind of a very sophisticated filter. Yeah. And they're incredibly complex, as you can see, because they're somewhat different in between the two genders, women and men. For men, the male urinary system is comprised of the kidneys, ureter, bladder, and urethra. Urine is produced in the renal tubules and stored in the renal pelvis of each kidney before traveling through the ureters to the bladder, where it is stored until it is excreted through the urethra. And for the female side of it, the female's urinary system comprises the kidneys, ureters, bladder, and urethra. Urine production occurs in this renal tubules and gets collected in the renal pelvis of each kidney. Following this, the urine travels through the ureters and is stored in the bladder until expulsion from the body through the urethra. Here are some fun facts. Here are some celebrities who have also passed a kidney stone: Caitlyn Jenner, Alfred Hitchcock, William Shatner, Billy Joel, Kiefer Sutherland, Gene Simmons, Tim Burton, Burt Reynolds, Lyndon B. Johnson, and Rob Schneider. What are kidney stones? Kidney stones are solid masses of tiny crystals that can make their way into the kidneys or ureters simultaneously. This occurs when the urine becomes too concentrated and substances in the urine crystallizes to form stones, leading to the stones moving down the urethra and causing intense pain. And I'm pretty sure you can figure that out because of the way that they're shaped. It looks kind of like little diamonds a little bit, except they're not actually they don't look like diamonds. Types of kidney stones and causes. Calcium oxalate stones. The most common type of kidney stone is calcium oxalate stone, which are linked with foods high in oxalate, a natural occurring substance in plants and animals. These include beets, black tea, chocolate, nuts, potatoes, and spinach. Calcium phosphate stones. Abnormalities in the way of the urinary system functions causes calcium phosphate kidney stones. Struvite stones. More common in women, struvite stones form due to certain types of urinary tract infections. Uric and acid stones. More common in men. Uric acid stones tend to occur in people who don't drink enough water or have a high diet in animal protein. People with gout, a family history of this type of kidney stone, or those with chemotherapy or undergoing it. And the Christine stones. The Christine stones are caused by a hereditary genetic disorder called cystinuria that can lead to excessive amounts of amino acid Christine collecting in the urine. Here are a couple of symptoms. Symptoms may not arise until the stones move down the urethras When that happens, the stones will most likely block the urine flow out of the kidneys, resulting in the following symptoms occurring: pain in the belly area or side at the back, pain in the groin area, testicles or testicle pain for men, uh, and labia, vaginal pain for women. Abnormal urine color, as you can see on the right, you can see the different types of colors for urine and what exactly it means. Chills, like a cold, and a fever as well, like a cold, nausea and vomiting, basically like a cold. Some of these have cold-like symptoms, which is also important that you see a physician or anything like that. But yeah, and as you can see on the image on the right, we see the different types of urine color and how when it turns red, it's most likely something wrong with the kidneys because the kidney's job is to filter out unwanted elements within the blood. And when it's not doing that properly, most likely kidney stone or something else. All right, moving on. Here's another fun fact. In 2009, Gene Simmons actually raised $15,000 by selling his kidney stone on eBay and he actually donated the money to charity. Yeah. Okay. Let's talk about invasive treatment options to patients. Extracorporeal shock wave lithotripsy. This procedure uses shock waves generated outside the body to break the kidney stones into smaller fragments. The fragmented stone can then pass through the urinary tract more easily. ESWL is commonly used for smaller stones and is located in the kidneys or upper urethra. Ureth, Urethoscopy Ureteroscopy or scopy involves a thin tube inserted through the. Also, before I continue, for number one all the way to number four, it's in order of images. So if you would like to see any images, it's down below. Yeah. Involves using a thin tube inserted through the urethra and bladder to reach the stones in the urethra or kidney so that they can be removed or broken into smaller pieces using laser lithotripsy or basket extraction. Percutaneous nephrolithomy. This procedure is performed under general anesthesia. A small incision is made in the back to access the kidney directly. A nephroscope is inserted through this incision to remove or break up the stones. PCNL is often used for larger stones or when other treatments are not feasible. As you can see on the third picture, they're making incisions on the back. Open surgery, which is a very general term. In rare cases where other treatments are not suitable or unsuccessful, open surgery, nephrolithotomy, may be performed. This involves making a larger incision in the back to access and remove the stones directly. And as you can see, to each one of these descriptions, I've offered an image so that you guys can have a more descriptive look visually. Here are some invasive treatment options to patients, and I will be describing the pros and cons. Percutaneous, or PCNL for short. It's highly effective for large or complex stones. These are the pros. Allows for direct access to the kidneys through a small incision in the back. Can remove stones completely in a single procedure. Suitable for patients with anatomical abnormalities or other factors that may complicate other procedures. And now here are the cons. Involves a surgical procedure and requires general anesthesia. Longer recovery time compared to non-invasive procedures. Potential risks associated with surgery, such as infection, bleeding, or damage to surrounding structures. Hospital stay is usually required to make sure that the patient is being monitored and that he or she is safe. Open surgery. Here are the pros and cons. Rarely performed today, but may be necessary for very large, complex, or impacted stones. Provides direct access to the kidneys and allows for complete stone removal. Can address other underlying conditions or complications. Invasive procedures with higher risk compared to other options. Oh, sorry, I'm reading the cons now. Invasive procedure with higher risk compared to the other options. Longer recovery time and hospital stay. Higher risk of complications such as infection, bleeding, or damage to the surrounding tissue. Generally considered a last resort when other treatments are not feasible. Moving on, non-invasive treatments options to patients. Watchful waiting. And for those of you who don't know, this approach may be taken if the kidney stones are small and not causing severe symptoms. This involves monitoring the stones with regular imaging tests and managing symptoms with pain medication while allowing the stones to pass naturally. And for those who do not know this, watchful waiting is just a medical term to basically just it's a way of describing monitoring someone. Fluid intake. Increasing fluid intake, especially water, is often recommended to help flush out the stones and prevent new ones from forming. Adequate hydration can also facilitate the passage of small stones, kind of like a little river. Medications. Certain medications can be prescribed depending on the stones to help prevent stones from forming or help in dissolution. As thiazide diuretics can be prescribed to reduce calcium levels in the urine, and allopurinol may also be used to lower uric acid levels. And as you can see, I've offered images for 1 to 3. Non-invasive treatments options for to patients and the pros and cons. So for ESWL, the pros and the cons. The pros are non-invasive procedure that does not require any incisions or surgeries, generally considered safe and effective for smaller stones, typically has a shorter recovery time compared to invasive procedures, and does not require a hospital stay for most patients. But the cons it may require multiple sessions to fully break down larger stones. It's not as effective for certain types of stones, such as cystine stones. Can cause side effects like bruising, bleeding, or discomfort during the procedure. Stones may not completely fragment and may require additional treatments. And for ureteroscopy with laser lithotripsy, the pros are minimally invasive procedure that allows direct visualization and precise targeting of the stone, effective for a wide range of stone sizes and compositions, can often be performed as an outpatient procedure, typically has a shorter recovery time compared to open surgery. The cons requires the insertion of a ureteroscope through the urinary tract, which can cause temporary discomfort or injury. Potential risk of infection, bleeding, or injury to surrounding tissues. In some cases, a stent may need to be temporarily placed in the urethra after the procedure, not suitable for very large or complex stones. What is the solubility product concept? And I know this is coming out of nowhere, that we were just talking about the kidneys, but don't worry, it all makes sense. The solubility product concept is a chemistry term used to describe the balance between an ionic solid and its dissolved ions in a solution. This measured using KSP and indicates solubility of a compound. The solubility product constant varies for each compound and depends on the temperature. It determines whether a precipitate will form, dissolve, or exist in an equilibrium. This concept is crucial for understanding ionic compounds' behavior when they dissolve or precipitate in different situations. Now, let's talk about the link between kidney stones and the solubility product concept. The solubility product concept measures the maximum amount of compound that can be dissolved in a given solvent at a specific temperature. In the case of kidney stones, the solubility product is relevant in determining if dissolved ions in urine will remain in solution or form solid crystals. The link between kidney stone and formation and the solubility product concept lies in the equilibrium between the dissolved ions in urine and the solid minerals deposits. If the concentration of ions surpasses the solubility product, the equilibrium shifts towards the concrete particle formation. For example, calcium oxalate is a frequent component of kidney stones, and its solubility product KSP represents the balance between dissolved calcium ions, Ca2+, and oxalate ions, C2O4, 2-. In urine, if the concentration of either ions exceed the solubility product, calcium oxalate crystals may develop, contributing to the kidney stone formation. Understanding the solubility product concept helps to explain why certain substances have a higher propensity to form kidney stones. By controlling the concentration of kidney-forming substances in the urine, managing pH levels, and promoting the presence of inhibitory substances, it is possible to reduce the likelihood of kidney stone formation. And as you can see, I've added a little image below to have a little visualization. What social benefits are associated with these? The social benefits associated with these treatments options are significant. By effectively managing kidney stones patients can experience the following benefits: relieving pain and discomfort. Treating and eliminating kidney stones can provide respite from excruciating pain they cause, allowing patients to resume their daily activities without hindrance. This improvement in their quality of life directly results from effective treatment of the condition, preventing complications. Kidney stone can lead to urinary tract infections, blockages, and kidney damage if left untreated. Medical attention is crucial to maintain good health and prevent the condition from worsening, to allow those suffering from this to continue living a healthy and active lifestyle with their loved ones without extreme measures such as surgery. Enhancing productivity as the third one. Suffering from recurring pain and discomfort due to kidney stones can significantly affect productivity, leading to missed work or school days. However, treating kidney stones can restore individuals' ability to carry out their daily activities without interruption, ultimately promoting their overall well-being. How does this topic relate to the concepts learned in this course? In Unit 3, Chemical Systems and Equilibrium, we learn about the principles governing chemical reactions and systems at equilibrium. The topic of kidney stones formations and its link to the solubility product concepts connect to the following key concepts. Equilibrium. The formation of kidney stones involves a dynamic equilibrium between the dissolved ions in urine and the solid minerals deposits. Understanding equilibrium principles such as Le Chatelier's principle and the concept of equilibrium constants helps explain how changes in concentration, temperatures, and pH can affect formation or dissolution of kidney stones. Solubility product. The solubility product KSP is essentially in understanding kidney stones formation and dissolution. The solubility product determines the maximum concentration of ions in equilibrium with a solid mineral. Considering the solubility product one can predict the conditions under which kidney stones can form or dissolve and devise strategies to prevent or treat kidney stone formation. Factors affecting equilibrium. The formation of kidney stones involves various factors that affect equilibrium between dissolved ions and solid particles. These factors include the concentration of stone-forming substances, pH and temperature, and the presence of inhibitory substances. By allowing the principles of chemical systems and equilibrium, one can analyze these factors influence the formation and growth of kidney stones. Studying kidney stones formations and its connection to the solubility product concepts provide a practical application of the principles learned in chemical systems and equilibrium. It allows for a deeper understanding of chemical equilibrium constants, and the factors influencing the equilibrium state in real-life systems. Fun fact. Going on the Big Thunder Mountain ride at Disney World found that getting on the ride and going through it helped patients pass kidney stones nearly 70% of the time. In conclusion, kidney stone formations is a complex process influenced by the solubility product concept. Understanding the equilibrium between dissolved ions and solid particles helps explain why certain substances precipitate and form kidney stones. Exploring the kidney stone formation and treatment relates to the concepts learned in chemical systems and equilibrium. It allows for a deeper understanding of equilibrium constants, solubility products, and factors affecting chemical equilibrium. Applying this knowledge helps develop preventative strategies and effective treatments for kidney stone formation. Treatment options range from non-invasive approaches like hydration and dietary modifications to invasive procedures such as lithotripsy and surgery. But with everything discussed, I believe that chemistry has shown us that it generally has connections throughout our life. But if chemical systems and equilibrium truly have so many connections towards the kidneys, could a better understanding of the human body and its organs further our knowledge of chemistry as well? Thank you for listening to me, and that will be all for my presentation. Thank you.